Reflections during a rescue flight in Nepal in November 2024. So far, with a few exceptions, only secondary transports have been carried out in Nepal, that is, flights between two hospitals to transfer patients. The previous alarm times are too long for primary transports, that is, for rescue from the scene of the accident. In addition, the system is too inflexible. In an emergency where a helicopter is needed, the Medicity clinic is called. They call the nearest helicopter agency at the airport. These now clarify when a helicopter is free and in turn negotiate with the emergency reporter who is going to cover the costs of the flight. Until now, these have been paid privately by the emergency patient or his relatives. A rescue flight costs about 1,000 euros. This is almost a year's income. In particular, the unclear financing situation is delaying the transport. Nepal Aid has been cooperating in the Tamang region for years with doctors from the Medicity clinic who have joined forces on a voluntary basis in the Nepal Medics and Mountaineers Foundation, NMMF, founded by Dr. Sanjay Karki. They provide part of the medical services for people in need free of charge, and Nepal Aid finances free rescue flights from our project region. These are then actually primary transports. Nepal Aid and the NMMF are working together to improve the rescue system. Through the cooperation, we are involved in the provision of rescue helicopters and medical personnel involved. Nepal Aid established a German-Nepalese exchange of emergency doctors, which also leads to a professional and cultural exchange about different rescue systems and forms of organization. In Germany, our exchange project is supported by the German Air Rescue Service and the anesthesia department of the hospital in Ludwigsburg. Dr. Vera Kahle was our first German emergency doctor on a rescue helicopter in Nepal. In Ludwigsburg, there was a warm reunion during the return visit of Dr. Razu and Dr. Rohendra. Here we see how easy it is to transport a patient in Germany. The patient can simply be pushed on his stretcher by ambulance. A relocation is not necessary. Basically, we are working on the establishment of a donation fund and want to ask Nepal tourists to pay a voluntary amount. If all German tourists were to pay an amount of 10 euros each, around 300 free or partially financed flights could be carried out per year for people in need. Another mainstay are the approximately 100 German Nepal associations. If each association finances a few flights for its aid region, following our example, it will be possible to build up an initially patchy but steadily growing rescue network with few resources. We're also in contact with the helicopter agencies and negotiate discounts. If everything works out, we can get the flights for half the price. The fund would also help tourists by making it possible to keep personnel and rescue equipment available. They would also benefit from a better and, in particular, faster rescue. Your trip to Nepal would be safer. However, the rescue costs for tourists would of course still have to be paid by themselves. Together with the German Air Rescue Service, an expansion of the exchange program to other helicopter bases is planned. Here we see Dr. Brown from the DRF and Dr. Dhirendra in May 23 at the first preliminary meetings. and a still of Dr. Dhirendra at the Nepal Congress in Cologne. And at the lecture at the Gymnasium in Neuenburg, a secondary school. Our goal is to promote the project internationally as well, as the proportion of German tourists in Nepal is relatively small. Due to the altitude and landform configuration, however, there is no way around air rescue in Nepal in the future. We have very strong cooperation partners in prospect and are very much looking forward to developments in the coming months. We were able to drop off the patient very well at the Medicity clinic. I only found out afterwards that the patient should have been transported the day before, but the helicopter was fully booked with tourist flights. It's a dilemma. Without tourists, there would be no helicopters. There is now a change of heart among all those involved. There is talk of taking a helicopter out of normal operation and keeping it ready for emergencies. It is also possible that a helicopter responsible only for rescue will be put into service. Here too, we are curious to see how everything will develop in the future. Nepal Aid's financing system can be used to expand regional air rescue services as well as to extend flights to the whole of Nepal.